Well, Beth, nice to have you with us today.
Thank you.
And you're here to talk about good sleep and getting a good night's sleep. And a lot of people are really concerned about this because they're not resting at night, and it's showing up, excuse me, during the day. And snoring's a problem.
Yes.
Is it a problem? I mean, is it bad for you?
Snoring in itself isn't bad, but it can indicate something worse, like obstructive sleep apnea. And it's not so good for your relationship.
Yeah, well, yeah, one gets up and moves to the couch.
Right.
So
right.
what is snoring? What is the problem?
Well, snoring happens when you go to sleep and your muscles relax. And so if you have any extra tissues, say tonsils and adenoids, or your uvula, the little piece that hangs down in the back of your throat. Mm-hmm. So when everything relaxes and you're sleeping, there's resistance. And so you're trying to breathe in and out, and all of these extra tissues are going to vibrate and make noise. And that's what causes the snoring. When it becomes obstructive sleep apnea is when those tissues actually obstruct your airway. So your airway closes, and it's just like somebody's choking you all night long, and you're holding your breath and then gasping awake, and the cycle just continues.
So, see, people that suffer from sleep apnea and snoring, do they get into that deep sleep? Do you ever get to that deep sleep level that they say is so good for you?
Well, if you're talking about REM sleep, which is when we dream, REM is not really a deep stage of sleep, but it is necessary for us to feel normal during the day. So REM sleep is what gets interrupted the most when we snore and when we have obstructive sleep apnea. And so, actually even football players are prone to have obstructive sleep apnea because they have so much muscle mass around their airway, and so that relaxes and can cause the airway to actually collapse. And so when REM sleep gets interrupted constantly, that causes depression, irritability, moodiness, and sleepiness.
Wow. And then the psychologists get involved.
Exactly.
Okay.
And then you start getting pills for your depression, and you know.
Wow. Now, we've seen a lot of devices to help with this, from the nose bands to full mask. Tell us about those. Do they work?
Okay. Yeah, they do. So the nose bands, am I allowed to say the name? Breathe Right strips.
Yeah.
They work if somebody has an obstruction up in their nasal airway. They can be costly, but they do work. There are dental appliances for sleep apnea, which if somebody just has snoring, they are helpful. The over-the-counter ones tend to wear out a lot faster than the custom-made ones by a dentist. So those work for if your problem is just snoring. So, yeah.
Sometimes I hear where people will start sleeping and then it's like they're not breathing.
Right.
How serious is that?
That's sleep apnea, and it's very serious. It puts you at high risk for heart attack and stroke. And so very often we have patients, husbands who've come in who have said, okay, I sleep fine. I can sleep anywhere, anytime. It's my wife that's making me come in because she's noticing these pauses in my breathing. And the pause could be at least 10 seconds, but then it's followed very often by a gasp or a snort. And sometimes the patient wakes up and their heart is racing, they have a dry mouth, but sometimes they sleep right through it and it's their spouse that's suffering. And so I can't tell you how many times I've heard the story of, I'm here because my wife has said either I go and get my snoring taken care of, or I'm sleeping in another room, or she's sleeping in another room, or she's filing for divorce.
Oh, yeah,
So
no, it's pretty annoying. All right, so how do you start treatment? What do people do that realize they got a problem? What's some of the steps?
well, the first step is to talk to your doctor, and you could be screened very inexpensively by just having overnight oximetry done. That's just a little pulse oximeter put on your fingertip, and it measures the oxygen level in your blood. So imagine if somebody is choking you all night long, so like as if you had sleep apnea.
Yeah, right.
The oxygen level in your blood is going to go up and down and up and down. So very often primary care physicians will order overnight oximetry, and it's very inexpensive, maybe $30. Sometimes it's free.
Okay.
So
now, how big of a problem is this? How many people are suffering with this?
up to 25%
of the population
of Americans have it, and only 50% have been diagnosed.
Whoa! Those are huge numbers. Now, sometimes people, I have no problem falling asleep, but apparently I got all these symptoms you're telling me because my wife's telling me that, and but I have no problem going to sleep. Is that part of the deal? I mean, I don't know if I'm just
Yes.
tuckered out and I'm ready to.
Actually, we hear that quite often. I had one husband come in and say, I don't know what her problem is. I can fall asleep anywhere, anytime. That is not normal.
Oh, really?
That is not
Well,
normal.
Another thing to add to my not normal list. I got a long one now.
If you can fall asleep in less than 5 minutes, that is excessively sleepy. It should take a normal adult between 15 to 30 minutes to fall asleep.
Really? Well, and if you don't take that long, you got a problem, I guess, huh?
Yeah.
Wow.
Yeah.
What about the darkness of a room? I've been told the darker the room, the better the atmosphere. Is that true?
Yes, and to keep your room slightly cool. There's something that's called your circadian rhythm. It's your sleep-wake cycle. And so when your body senses light, it tends to bring you into those lighter stages of sleep and get you ready to wake up for your day. And so it's good to have a nice dark room, especially for shift workers. That's really important, who need to sleep during the day.
All right, so for those who want to get checked out, go to your doctor, and they may recommend you to come to like one of your places there and
Right.
have the big test done, huh?
I'm the manager at the Rogue Valley Sleep Center, and we are the only accredited sleep center in Jackson County. We're connected with the Rogue Regional Medical Center. And so really the best starting point is your doctor, to talk to him about, the fact that you think you might have obstructive sleep apnea. If you can hear somebody snoring in the next room, there's a 95% chance that that person has obstructive sleep apnea and not just snoring. So that's a good test right there. You can also record yourself if you have a smartphone.
I don't know if I want to do it.
Or if your wife is poking you in the ribs all night,
Yeah.
that's a good indicator too.
Yeah.
If you're snoring when you're on your sides, that's a good indicator that it's more than snoring.
Okay. See, I know. I only do it when I'm on my back.
Okay, then that would be called.
And then I have one of those pillows I change, and once I get the pillow right, I seem to do a little better with
right,
it.
because it's opening your airway,
Yeah.
positioning your head that way.
Right.
You don't want to sleep with a bunch of pillows causing you to be in this position when you're
Okay.
sleeping. But if you're only snoring when you're on your back, and you don't on your sides, there's a good chance that it's just your tongue that's sliding back and blocking your airway. So in that case, you would just sleep on your sides. Try to stay off your back. Some
Okay.
people roll up a towel or put tennis balls behind their back and
Wow.
try to stay off their back.
Does this affect blood pressure?
Yes, it does.
How?
Sleep apnea actually causes high blood pressure, and there's research on that.
Really?
Yeah, it's the sleep apnea that causes it. So if you get your sleep apnea taken care of, then very often you either reduce or go off of your high blood pressure medication.
What about people who are using sleep aids, a lot of pills and stuff like that? Does that play into this? Or is it delay the inevitable?
Sleep aids would be more for somebody who's suffering from insomnia. So the definition of insomnia is difficulty initiating or maintaining sleep. And at Rogue Valley Sleep Center, we actually have an insomnia program. It's quite extensive, and it's also fairly inexpensive, and a lot of insurance covers the whole thing. And there's really a lot of simple things we can do to take care of our sleep. It's called sleep hygiene. So Michael Schwartz, who works in our lab, who does the insomnia education, he works with you and helps you discover what areas you need to work on, and gives you some tips on better sleep hygiene.
Is this prone to be with certain ages more than others, the sleep apnea?
Sleep apnea, well,
Can children have this problem?
yes, actually, I'm glad you asked that. It is unusual for any child to snore unless they have a cold. Usually it means that the child needs their tonsils taken out. And they've actually done research back east at Brown University and found that 20% of children who have been diagnosed as having ADHD actually just have a sleeping disorder and may have obstructive sleep apnea and just may need their tonsils out. But they're getting treated as if they have ADHD.
Wow.
Because this is what's interesting. So in children, when they get sleepy, it manifests as hyperactivity. In men, when they get sleepy, it manifests as excessive daytime sleepiness and you're constantly falling asleep. In women, it manifests as fatigue. Isn't that interesting?
It really is. Yeah, it really is. So there is no really demographic limit to this, or?
Typically, we see more men in the sleep lab than women for snoring. But we do see kids. We test kids from 3 years old and up.
And these CPAP units, they work?
CPAP, yeah. CPAP stands for continuous positive airway pressure. That's the gold standard treatment for obstructive sleep apnea. Yes, they work. Are they easy to get used to? Not always. If somebody has severe obstructive sleep apnea, they are usually the ones that love it and say, this is the best night's sleep I've ever had, and want to tell everybody about it. But if you have mild to moderate, it takes a little more work to get used to it.
Wow.
And actually, we have a program at Rogue Valley Sleep Center where, and it's free, where we help people to try and get used to it.
Good for you.
So,
all right, so people want to get a hold of you, what do they do?
just call the Rogue Valley Sleep Center, or you can go to our website, rvsleepcenter.org.
And check in.
Yeah.
Okay, well, Beth, thanks for being with us. A lot of good information, and hopefully a lot of folks will take advantage of it. I know it's a big issue with a lot of folks, and I know those who have gotten treatment, and it's changed their lives. It's for the better, for the better. Thanks for being with us.
Thank you.